Hi, I'm Dr. Daniel Clark, Director of Orthobiologics here at the Protea Performance Center, where we specialize in interventional regenerative medicine techniques to help patients heal from injuries and overcome pain. And I have here also Dr. Bronwyn Carlblom.
Hi, I'm Dr. Bronwyn Carlblom from Protea Medical Center, where we focus on overall wellness, longevity, and hormone optimization. And we're here to talk today about how we work together, actually, to manage your overall health, your hormonal health, and your pain.
So hormones, I see, can play a massive role in pain healing or tissue healing. If things are not optimized, the body doesn't have that foundational mechanism it needs to heal properly. That's where I love to work with the Protea Medical Center, where there's expert physicians in that field that can help get your hormones in that optimal place to be able to heal effectively. And with the advanced regenerative medicine techniques that we have and the hormonal optimization that they can do, that whole body approach and whole person approach leads to much better outcomes, especially in that postpartum period and even postmenopausal period where hormones are kind of all over the place. So I want Bronwyn to kind of talk a little bit more about what's happening in that period and what they can do about that, and that kind of interplay between that and how regenerative medicine is able to help.
Yeah, I think something interesting that a lot of people might not know is just how directly hormones influence your joint health. It's not just two isolated systems, your physical health and your hormonal health. Everything is working together and influencing each other. One thing in particular that's really helpful to think about and that we are managing very directly in our patients are estrogen levels, especially in that pregnancy, postpartum, and then eventually postmenopausal range or postmenopausal time periods in life. Those estrogen levels have changed dramatically. We go from normal menstrual cycle with reasonable fluctuation throughout the month to actually incredible highs of estrogen during pregnancy, followed very quickly within a matter of days or two by incredibly low levels of hormones that are very similar to those in menopause, all within a matter of days again. And we can see that impact many things for patients, how they feel overall, emotional wellness, anxiety, postpartum depression, all of those things come down to estrogen and those fluctuating hormone levels. But we also see an increase in pain. More joint pain, more injuries, and I think it'd be great to talk about how that, where that comes from, why that happens, what we can do about it, and how you can help us in treating our patients as well.
Yeah, so throughout pregnancy, you have a release of a hormone called relaxin. As the name suggests, it helps tissues relax, but specifically it helps ligaments relax. And the reason this is produced is so that our pelvic ligaments are able to stretch a little further than they would otherwise so that you're able to birth a child. Interestingly, both high levels of estrogen essentially prime those ligaments to be able to respond to that relaxin, and then that relaxin comes in to stretch those ligaments. In some people, those ligaments can return back to that normal tautness or tightness postpartum, but in a lot of cases that doesn't happen. And so what I tend to see in my pain patients is after they've had a child or multiple children, they start to develop low back pain, pelvic pain, but even in interesting cases, knee pain, which we'll talk about with Dr. Carlblom, is these ligaments don't return back to where they were before, which can lead to excess joint movement, micro movements that lead to irritation, inflammation, and degeneration a little bit quicker than they would have otherwise. Specifically, an interesting one is in the knee, and the ACL in the knee has a higher density of these receptors to be able to respond to relaxin, which increases how stretchy that ACL becomes. The ACL's responsibility is to prevent your tibia or your lower leg bone from sliding forward on your femur, your upper leg bone. That excess movement causes extra wear and tear on your meniscus or the little C-shaped pads in your knee that help kind of hold the knee in place, provide that cushioning. And specifically, Dr. Carlblom had some knee pain that worsened after pregnancy. no specific injuries, right? We think ACL, we think athletes and like sport specific injuries, but she didn't have any sport specific injuries, but she had a loose ACL on her physical exam, as well as on MRI, we could see some sprain of the ACL, but no clear specific injury that happened to it. And the most likely cause was this increase in relaxin. Additionally, after this postpartum period, like she said, hormones drop. And so trying to get those hormones back into that ideal range again to be able to support tissue healing is going to be paramount to that recovery process. So what is something that you do, or how do you support women in that postpartum period to get hormones back on track and in those kind of healthy ranges where they feel good again and can heal properly?
Yeah, so great question. And I think it's a little bit of a catch-22 because we have some conflicting goals in the postpartum period, right? Hormones returning back to where they were pre-pregnancy is wonderful, but it's counterproductive when it comes to breastfeeding. So it really depends on mom. If goal is to breastfeed baby for whatever amount of time, we know that during that time period, those hormones are going to remain low because of the feedback mechanisms and feedback loops in the body that allow us to breastfeed. So what were once sky-high levels of estrogen during pregnancy are going to remain low during the breastfeeding period for most women because we have that feedback from another hormone called prolactin, which allows us to promote lactation for feeding baby. That kind of gives a nice insight how we work together also, because if we are going to have hormone levels remaining in an less than desirable state, we might need you to come in and help us out, right? But many of the things we do involve getting that menstrual cycle back up and running. That's a lot easier if mom is not going to breastfeed because we can allow the ovaries kind of to return to their normal function. But there's other things we can do with food and supplements that promote this estrogen-like activity in the body that potentially could help mitigate some of those things. So basically what I experienced postpartum, I've had knee pain most of my life, I think. Nothing super severe. I've never had like an isolated injury, never required intervention, but just kind of generalized knee pain from activity. I was an athlete growing up. I remain athletic or active as an adult. But once I had my first child, I noticed this new onset of specifically medial knee pain that I had never experienced before. And that was accompanied by some instability. It was not super pronounced maybe with my first baby. It seemed to kind of recover on its own. Again, probably along those lines of where my menstrual cycle returned, I finished breastfeeding, and things kind of resumed their pre-pregnancy levels. But with my second child, it became much more pronounced, almost on the same timeline. Within a few weeks post-delivery, that knee pain was back. And if I'm remembering correctly, I believe she was about 6 weeks old, I started noticing much more pronounced instability. It felt like my knee was hyperextending if the dog barely bumped into me or if I stepped funny. And then also developed this clicking, catching sensation that had never been there before. And again, there was no injury. Maybe my posture had changed a little bit, or I was, spending more time in a rocking chair with a baby. But yeah, it was this kind of unmistakable pain and instability without any known cause. So I came to see you, and we did some imaging and discovered that there were some things worth treating. And we did PRP. Why?
Yeah. So with a case like this, one of the only ways we know how to tighten or strengthen ligaments are with regenerative injections. So in most cases, PRP fits the bill for a case like this. So PRP is platelet-rich plasma. We draw the patient's blood, we spin it down in a centrifuge, and we concentrate those platelets in our blood, which are cells that are responsible for healing tissues. They're kind of the first responders to injuries. They release growth factors and signals to start a new healing response so that those damaged or loose ligaments can then start to heal, tighten. The body puts more collagen there to make them more stable. And so really the goal here with some strength training to strengthen the muscles, but also PRP injections directly into those loose and damaged ligaments can help tighten them, improve stability. And something that you mentioned about that medial knee pain, what you see a lot with loose ACLs is that extra micro movement that happens between the tibia or the lower leg bone and the femur and the upper leg bone. When they move back and forth, the meniscus is like a C-shaped cup, and that ACL is no longer holding it in the center of that cup, and now that meniscus is taking the kind of brunt force of trying to hold that femur in place or acting as like a backstop. And so the longer you let this go, the more degeneration and damage can happen to that meniscus. And so that was also part of our treatment, is treating around the meniscus to help that degeneration and some of that damage that occurred to heal and cause less of that pain and swelling. We treated the MCL, or the medial collateral ligament. It's kind of a strap of ligament that goes over the medial side of the knee and holds that meniscus in place and keeps it stable. And then on top of that, we treated the infrapatellar branch of the saphenous nerve. Super long nerve name. Ultimately, it's a small nerve that goes over the medial side of the knee, over that meniscus, over that MCL. And what can happen is when there's a lot of irritation and inflammation in that area, that nerve is just kind of a bystander. You know, it's not in the fire of inflammation, but it's nearby that fire of inflammation, and it feels the heat and then starts to get irritated. And so we treat that nerve as well to provide that full comprehensive treatment to help with pain. We treat those ligaments, meniscus, the ACL, to help with the stability long term. You know, if you leave something like this unaddressed for too long, you get an increased risk of earlier development of osteoarthritis in the knee, again, because you have that extra movement, the extra gliding, the extra irritation, and that cartilage is going to break down a little bit faster. And so this is both kind of an active treatment in addressing today's symptoms, and it's also preventative treatment for addressing tomorrow's symptoms as well. So treating it comprehensively is extremely important. Don't ignore it. The sooner you can address it, likely better outcome that you're going to have.
So basically you're telling me that the same hormones that allowed my body to accommodate and then birth a baby have screwed me on my knee. Is that what's happened?
That is, yes.
Okay.
Simply yes.
Okay. Another wonderful reason to have care from both sides, right? Something else we consider on our side of the aisle in these situations, and just with our postpartum moms in general, is postpartum nutrition, which is so important, especially for number one, and just the recovery from pregnancy in general, which is just a drain on the entire system in every possible way. If you don't know, a great example of this is flamingos, which we know are pink, actually turn white or gray after laying an egg and hatching their baby. And it's because all of that nutrients leaves the mom. All of the pink leaves the mom, which is coming from the food they eat, to grow and nurture the baby, which is a very literal representation of what pregnancy is like for women too. But in especially our breastfeeding moms, so much of our nutrition is going to baby at the expense of what happens in our bodies. So continuing to take your prenatal supplement is really important. And that's important for you, mom. It's not important for baby. Baby will get what baby needs at the expense of your body. So calcium that you're not taking in is going to come from your bones and your teeth. So we see an increased risk of fracture. We see increased risk of dental caries as well, so cavities at the dentist. So calcium supplementation is super important for that. But same thing with all of our other vitamins and minerals. So making sure that we're keeping your bones healthy and strong so that the ligaments have a solid place to attach to is really important. And so we focus a lot on postpartum nutrition, especially in tandem with what you can provide with regenerative injections.
Like I mentioned, the whole goal of regenerative injections is to stimulate a new healing response. And in that process, the body's laying down new tissue, it's trying to heal it, and it needs the building blocks necessary to make that happen, which is proteins, it's vitamins, it's collagen. And if you don't have those basic nutrients, and especially if, like she mentioned, you're depleted post-pregnancy because you're giving everything to baby, your ability to heal on its own is going to be difficult. And then when you layer on regenerative injections, where we've now amplified that healing response, it's going to be even more difficult to heal. And so, again, another great reason why addressing it from both angles, addressing you as a whole person, making sure you're foundationally healthy, that you can build a strong body on top of that.
Totally. So we talked about the effects of the really high levels of estrogen, right? We know in pregnancy the levels are reaching quite literally thousands times higher than they ever are in a normal menstrual cycle, which is wild. They're growing baby bones, they're growing baby ligaments, all of those things. And that causes that ligament laxity that you mentioned, so making those ligaments longer, stretchier, more prone to problems. But then when we reach that postpartum period again, where the hormones come crashing down, very similar to menopause, we end up with really low levels of estrogen, and that causes issues as well, right? We see more issues with potential tears or brittle ligaments that can cause problems. So what do we do? I know what I do on my end, especially in menopause, where we're working to achieve kind of a suitable baseline level of estrogen back in the body, but what can we do in those situations where we have those frailer, more brittle ligaments?
Yeah, so in a case like that, so in that postpartum or postmenopausal, I see a lot in my postmenopausal patients where their level of activity, let's say, I have had a patient recently, very active person, and developed an elbow injury, had some tennis elbow, or really what that is the tendon breaking down around the elbow. And initially wasn't super excited about the idea of injections because she was going to have to take a week or two off, and the activities that she was doing, it was her livelihood. And so it wasn't much of an option for her to take time off. And so I referred over to the medical center side and said, hey, let's get her hormones on track and see what we can do from there. And then maybe the treatment on my end can be a little less aggressive, a little bit easier on her body where she doesn't have to take much time off. So when they did all of her blood testing, they noticed that the testosterone, estrogen, and progesterone were all very low. And so addressing that in the process, one, obviously made her feel better, which, allowed her to exercise, do the physical therapy type exercises that she should have been doing, as well as just kind of feeling better overall. That testosterone, estrogen, progesterone are key hormones in our body's ability to repair damaged tissues. They are anabolic. And when our bodies are in a state of catabolism or catabolic, they're breaking down. And what we see is that the body's breaking down faster than it can repair. And a big portion of that comes from that hormone balance. And, excitingly, we didn't need to do any sort of regenerative injections in this case, just by addressing the person's foundational health hormone status. We were able to improve her pain, get her back to doing what she loves to do and does for work without having to do any sort of regenerative injections, which I think is really exciting. And on top of that, physical therapy is another big portion of that, especially postpartum, a pelvic floor therapist especially, because a lot happens in the pelvic floor when you go through pregnancy. A lot of ligament stretching, muscle issues, especially core I see too, right? Obviously your abdomen is stretching out quite a lot, and so you're losing that core stability during pregnancy, of course, because they're so stretched out that they can't really stabilize the core much. And then afterwards, there's a lot of stretching of those muscles still, stretching of some fascia in that area, which takes a long time to recover. And if you're not actively trying to strengthen those and tighten those, you get a lot of extra movement again in the kind of core region, which leads to or can lead to chronic low back pain. And so those are the two things that, I really always try to address in those patients, because, I can do a regenerative injection to the spine for someone with low back pain, but if the muscular and core stability is not there, if those hormones are not optimized, it's going to reduce the chance that we can get long-term benefit from the regenerative injections. Yeah.
Totally. I think this whole subject in general is just such a great example of how closely we work together for our patients, how important that is. But also just how important individualized care is. If we subscribed ourselves to a one-size-fits-all model where we have an ACL tear or ACL laxity, whatever the particular patient case is, and we treat that with PRP and that's it, without regard to the patient age or where they're at in their hormone cycle, male versus female, we're not going to get the best results. So sometimes we have to let the regenerative treatment lead because we're in a position with a breastfeeding mom where we can't manipulate the hormones very well, or other times we let the hormones lead. We have a postmenopausal woman who's very deficient deficient in hormones that her body so desperately needs, and replenishing those first can guide us to really what the patient actually needs once we get that body back to balance. Another one that we see a lot of in postmenopausal women, I think, which surprises some people, is frozen shoulder. That rotator cuff area, frozen shoulder, is a condition where what it sounds like, the shoulder's locked in place to some extent, so the range of motion is really greatly affected, and estrogen is a huge contributor to that one too. I see a lot of women come in with shoulder pain being their primary symptom in menopause, and having Dr. Danny on our team is so crucial so that we know if something is actually torn and needs to be treated, we can address that. But sometimes just giving the estrogen back is enough. We need to lubricate those tissues, restore that good cartilage foundation, and then the range of motion, when it, comes back with a little bit of hormones in the body. So I think allowing each individual patient's particular needs, particular story, where they're at in life, and what their hormones look like is so crucial to guiding us for what we need to do to keep our patients healthy, and how we can help them heal the most effectively rather than just treating them all the same.
Yeah. The frozen shoulder example is a really good one because, females are more at risk of getting frozen shoulder. People who have hypothyroidism also more at risk for frozen shoulder, and then having prediabetes or type 2 diabetes also puts people at risk of getting frozen shoulder. So again, I can do my treatments, but if those foundational things are not addressed, the chance that it comes back is better than if they do get addressed. And I would rather send to an expert on the Protea Medical Center side of things to get those under control first, and then we can do our treatment, or we can do it at the same time as well. Because obviously we have to balance the patient's pain with, what they need day to day. And, if that means repeating it a second time while they're still working through things, but again, just making sure those things are in place and healthy, optimized, it's going to lead to better outcomes. And I see that day to day in my patients for sure.
Totally. Another aspect I think that's so important to think about too, we talked a lot about pain and injuries and what we can do about that, but I know we wanted to talk about how our patients feel too, which is hugely important. Postpartum and postmenopause, using those examples again, are just such vulnerable times for women. We're not feeling like ourselves. We're very subjected or more likely to develop depression, postpartum depression, or depression in menopause, anxiety, poor sleep. We have different physical demands. If it's menopause, we have aging bones that can be weakening our strength, and so part of what helps our patients recover, part of what helps your patients recover, I think, is them feeling well also. So we need you to feel vital and energized and motivated and happy, or open to being happy. Maybe we could think about it like that, just that the sun starting to shine a little bit brighter again. When you feel better, you're more likely to attend your PT sessions and put in the work. You're more likely to show up for your follow-up visits. You're more likely to go to the gym or eat the right food or make the right choices for your body. So we're not just, treating your lab values and making sure that your estrogen is back where it should be. We're not just treating your pain and injecting the ligament that is suffering. We're also treating you and how you feel, so that you can choose to recover well, and so that you have more longevity and live longer and happier. What a concept.
If this sounds like something that you've been struggling with, or you have more questions about this to see if we're able to help you, feel free to call our office. It really doesn't matter which side of the practice you start on. Leave that up to your own intuition. We work really, really closely together as a team, and we will make sure to guide you in the right direction the best way that we know how.
Absolutely. We just want you to come in. If you're struggling with hormones or postpartum period, postmenopause, perimenopause, any stage of life where pain is plaguing you or your overall wellness is not where you want it to be, come in and see us. We'll get you to the right place. We'll take care of the whole body altogether and make sure that you're living your best life.